we had lovely GPs, that you almost felt like they were friends. Sadly, they left, and it started going down, and I thought that perhaps I should try and get it back up to the standard. Naively thought that I could make a difference, and I hoped that in certain areas I certainly had tried to introduce things and tried to be the patient's representative. Other of my colleagues who have since joined, who I admire greatly, think they are more of an ambassadorial role. And so between us, I think this will be a happy medium. Very important to me, I will not sit and just natter and get nowhere. I appreciate it's a bit like turning around an oil tanker. It takes time and you have to nibble away. But an example would be, somebody complained to me that they were expecting a phone call on a certain day from a GP. They stayed in all day, they had the phone with them all the time, and they claim that they never received this phone call. So I asked the practice manager in a PPG meeting what was the policy about when the doctor phoned and they didn't get an answer. And his reply was, oh, they're all different. All the GPs do different things. So I said, no, well, I don't think that's satisfactory. We should have a definite policy. Would you go and ask them to agree a policy of what to do when they make a phone call and they don't get a reply? And he did that, and we did get a policy that they would ring twice. At least it was a policy so that people would know that they should get 2 phone calls. If you think there's a problem with your surgery, don't just sit there and moan to your wife or your friends. I think you really should try and do something about it. I can't promise you're going to change the world, but you can contribute your views, and they are heard. They are definitely heard, and it's taken forward, and you make changes slowly.